and insights from research recently commissioned by Grand Challenges Canada about work they've been doing to support the development of their inclusive learning in play, in crisis settings. So Fawad is a paediatrician and the Senior Director of the Humanitarian Innovation at Grand Challenges Canada. And we're going to be hearing from you today, Fawad. So I'd love to hear a bit more about the research, the scoping study, the consultations. So if you'd just like to give us some insights into what the focus of the studies were. Thank you.
Can I borrow the mic? Yeah.
Oh, here.
Well, thank you for having me. Good afternoon again, everyone. Maybe before talking about inclusive learning and crisis setting, just a little bit context for those who don't know what GCC does and how we work. We are a Canada-based innovation funding and support platform. And after this morning's conversation, we are a global north-based organization, so guilty as charged. But we are trying our best to be a good partner. So Grand Challenges Canada's work is based on the Grand Challenge model. But I wanted to hear from audience if anyone who knows what is Grand Challenge model. Okay, we see a few hands. Excellent, great. Wow, that actually is great. I mean, there are like about 10 people who know what Grand Challenge model is. But for those who don't know, just a little bit of context there. Grand Challenges model is based on an understanding of identifying global macro issues that affect humanity. And then the next step in that process or in that model also involves mobilizing a critical mass of like-minded partners, local and global, to come together to address that global macro issue. And then the third step in that process includes a learning and iteration process where there's a continuous learning and kind of feeding back into the mechanism. So when Grand Challenges Canada was established in 2010, this model was adopted in the context of our work, initially with the global health, and later on we added the humanitarian innovation program. So relevant to today's conversation, GCC has been one of the key players in the ECD sector through our Saving Brains platform. And through that platform, we have funded over 150 innovations in 40 plus countries, and we've invested about 85 million Canadian dollars through that platform. Some of these innovations, actually, we have some partners in the room and a few others who are actually based in Kenya. On the other hand, we also have nurtured what is called Creating Hope in Conflict, which is our flagship portfolio focused on conflict settings. So it's actually the only humanitarian innovation fund that exclusively focuses on conflict settings. Last year, actually 2022, we have started some conversation for partnership with the Lego Foundation on how can we expand the learning from these two portfolios in emergency settings. That's how the inclusive learning in crisis setting was born. So following the Grand Challenge model, for us to be able to launch our call for application for the inclusive learning in crisis setting, we needed to do a deeper dive scoping analysis to understand what are the needs from the perspective of local partners in the 4 countries of focus. So the initial four focus countries include Kenya, Uganda, Lebanon, and Jordan. But the vision for the portfolio is to expand and work in all emergency settings. So we have entered into a partnership with Aga Khan University's Institute for Human Development. Dr. Amina Abubakar, many of you know, she's a global leader in the ECD sector. So they've mobilized partners here in Kenya, including E&K, a consulting firm, and in Lebanon and Jordan, Advise Me, which is another local firm there, who have then conducted the scoping analysis. In terms of, back to your question about the methodology, The scoping analysis included a couple of components. First, deeper dive literature review. So in all of this, we have used, I have to cheat for this. This is a methodology I wasn't familiar with. It's called ARC-C and O'Malley framework. Apparently, it's a globally known research methodology that they have used, and it includes 6 steps, including starting a deeper dive in literature review, followed by consultation with stakeholders, local and global, and then a final stage of consultation with experts, again, local and global, to fine-tune that. And this is very much aligned with the process that we follow. So this consultation included 429 stakeholders in all these 4 countries, from international organizations, governments, private sector, children, their parents, refugee-led organization, community-based organizations, and other partners. And then following that, we have brought together 40 global and local experts who, including, I think you were part of that group, of course, yes. And a few others in this room, who then took the kind of the condensed outcome of that process, and then helped us to develop what we call the challenge statement. So that's basically the problem statement that goes into the RFP that we will launch in January.
And what struck you particularly from the findings across all of the stakeholder feedback? Because I'd like to do a deeper dive into the findings from the children and the caregivers themselves. But in the first instance, sort of looking globally, what really jumped out at you?
Well, two key things that surprised us. Recently, in the past couple of years, GCC has started applying in kind of a more improved version of our older model, which was launching global calls for application. But over the past couple of years, we've started developing country-specific challenge statements. So our expectation was that, or our hypothesis actually, was that because we are going deep in each country and consult stakeholders, we would get quite unique challenges in each country. The surprise was that what came out of the consultation, we got a range of common challenges across all countries. So they're very similar with each other, except maybe a few here and there, local nuances. But in general, 4 or 5 key things emerged from that. The second surprise was that, of course, play-based learning is now a key approach in the sector. And in the consultation, interestingly, children actually talked about that and commented on it as a priority for them. Caregivers, educators also talked about it. But none of the parents who were consulted really mentioned that as a priority for them. So we don't know why, but we have some theories on it. So one could be that because there are too many things, too many priorities, perhaps they had to make choices as to mention things that are more important for them. Or it could also be that it is lack of understanding about importance of play in the learning of children. So these two, of course, kind of were surprises for us. But of course, we respect that. We respect it because that's the local reality in both cases.
And you shared that there were 4 or 5 common themes that went across all of the contexts. What were those?
Well, a number of things. Well, some of them actually were mentioned in the morning sessions as well. A holistic approach to childcare was really one of the key messages across all 4 countries. And of course, the nuances were there in each country. For example, in some context, holistic meant including education, ECD, health, WASH, and other sectors. In some contexts, like Uganda, for example, it meant including parents, caregivers, educators, and other actors in the education system into the childcare solutions. Role of digital solutions in responding to the needs was another area that emerged. Of course, except parents, everyone else mentioned play-based learning as the key. And then more investment in psychosocial and social well-being of children, as well as educators and parents, because that they also need it. So these were like a couple of four or five common themes that have emerged.
And what specifically did the parents want to focus on that diverged from those sort of core areas of focus? And what were the distinctions or differences across the different contexts?
For parents, distance from, and these are some really interesting perspectives that emerged. Distance from their home to the child care center or education center, school, came up as a major issue. Both children and parents and caregivers talked about lack of physical space for learning and play. Other topics, more, and this came up in the morning discussions as well, more educational programs or childcare programs, so the parents and caregivers have more time to, particularly young mothers, adolescent mothers, to focus on their education, because that's a common issue, particularly in East Africa region. But also to help them with their psychosocial support needs as well. And also children with special needs. That also came up. Children with disability, those who have special needs. And that also was an area that really were prioritized by parents.
And we've heard a lot this morning about the specific needs of locally led and refugee-led organisations, and I'm wondering whether through this sort of detailed research and analysis, whether there were any additional insights that you gained from the specific support that they require to work within their communities to provide access to these sorts of services, and how that's going to be squared within the sort of quite institutional framework of grand challenges funding, how those actors going to be able to access the challenge.
Yeah, of course. I mean, a number of themes have emerged. First of all, that fact that they would like to have more direct access to the fund and support that we provide. That came out as a key priority. And how are we going to respond to that? Of course, GCC has always prioritized local innovations. Over the past 14 years, we've funded 1,700 innovations across various programs and portfolios. 65% of those innovations are locally led and locally owned. Yeah. Of course, that's a quantitative number. We've done a lot of other work qualitatively as well, including as part of our new strategy to do more in terms of identifying local priorities, and the process that I just described earlier is part of that. But we have also unpacked that this whole idea of localization and power shifting. So what does that mean for us? And as part of that, we've learned that there are 2 or 3 pockets where we need to do more in sourcing innovation, for us to be able to source more local innovations. Identifying and selecting innovations, and then risk management and fund management, or risks related to the fund management in these 3 areas. The process that I just described helps us to address the first one in terms of sourcing local innovations. So when we launched the call for application for this portfolio in January, this will prioritize local innovators, particularly refugee, IDP, and host community-led innovations. They will be prioritized. That you will see that in the RFP. The second part of that learning about power shifting for us is the selection process. So that's actually a strength of GCC, but we can do a little bit better in that area, because we don't select the innovations. We assemble an external peer review group. Each application is reviewed by 3 external peer reviewers, and they mark it, and the average number guides us whether we can select them or not. And these peer reviewers are people who have both technical and contextual, or at least one of these two expertise who can advise us. And then in terms of the risk management, that's conversation not relevant here, but we are changing our risk tolerance framework. We are going to take more risk, even more than what we do right now. So through that mechanism, we are confident that we will be able to bring more local innovations into our portfolio, including from locally led and locally owned innovators. But on the second part of your question, a few other things that emerged from this consultation with the refugees. They emphasized on digital solutions again, and interestingly, more investment in the measurement, evidence generation, and learning in the sector came up from the RLOs and LLOs.
And is that investment in measurement of learning outcomes or strengthening organizations? What are the metrics that are going to be looked
yes.
at? Okay.
So supporting RLOs in strengthening their own capacity, because GCC provides both funding and support, and so this was included in the consultation that if you had this opportunity, what kind of learning do you need or prioritize? And so this included learning for the RLOs and LLOs, but also learning for the sector in the community they work, in the context they work, that the learning is captured across the sector and then fed back into the sector and ecosystem that they work with.
And will you be creating a sort of learning community across the 4 contexts, or are you going to look at sort of creating context-specific learning communities in each of the 4 countries that you'll be focusing on? Because that's also very interesting, isn't it, that opportunity?
Yeah. As I mentioned earlier, that is part of the Grand Challenge model, that we create a learning community. In our other portfolios, including the Saving Brains, we develop a global community of practice, or a learning community that includes representatives from various contexts. Now, in the context of inclusive learning in crisis setting, we will definitely have a global community of learning with country-specific representatives, or hubs or spokes, perhaps spokes in those contexts. Yeah, that's why we partnered with the Aga Khan University, and these two advised me and ENK in these 2 contexts, because we don't have presence there. We are only based in Canada, so we would rely on their presence in those contexts.
And as a member of the Moving Minds Alliance, I know that we can help to sort of push out information about the launch of the challenge. I think it's going to be launched in January, which of course we're very happy to do. But what else can the Moving Minds Alliance do to support this work that you're going to be investing in? And how can you feed back into the Alliance the learning that you're generating to help us strengthen our capacity to really invest to strengthen locally led ECD in emergencies, both in development and humanitarian context? What can we do to take this forward?
Well, I mean, as I mentioned yesterday, for those who were here, I made a pitch yesterday that when we joined the Moving Mind Alliance last year, one of the key objectives for us was to learn from this community, but also to benefit from this community in terms of dissemination of these kind of opportunities. That's something that it's both an offering, but also at the same time an ask from this community. And I'm so pleased to see that representatives from RLOs and CBOs and LLOs are here. So that's an expectation or a challenge I would actually pose to colleagues here. When the call is launched, please disseminate it, because our objective is to reach to the smallest innovator who has like a new idea and no one else is funding it. Our funding is actually for that. It is a high-risk tolerance fund. If you fail, we are with you. It's okay. That's part of our design. So out of the 1,700 innovations we have funded, about 70% of them have failed, and that is part of the innovation business, and we accept that. Other than that, I think the learnings from the scoping analysis, we will share that. We'll actually publish it as a public good document, because there's a lot of inefficiency in the sector. Many of us do the same thing over and over. There is a lethargy or exhaustion in the communities of like data extraction every time each of us go and ask them for information. But this is a rigorous process that we've gone through, and we will make that available to you. But there's a lot of content in that report, and some of them I mentioned. Those should be our guiding directions in our future programming, not only for GCC, but for everyone else who actually prioritize ECD in these, and education in these contexts.
That's excellent, and I'm sure we can collaborate with you to host a webinar or some other form of platform to share this learning. And I'd like to open now for questions. Is there anything else? Yeah? Katie?
You work in many innovative ways across your health, your mental health, your child development sectors. Can you share with us what are the different types of financing tools that you use?
Thank you. Well, this actually clarifies one thing for this call for application. So for the inclusive learning in crisis setting, based on the partnership that we have with the LEGO Foundation, this can only be a grant. But GCC as a whole, including in our Saving Brains portfolio, in addition to the kind of the traditional grants that we provide, we also provide loan and a whole range of them, and equity investment. So equity is new for us. We've started using it only in the past couple of years. And we do both direct equity investment, like buying stocks and those things in the companies that need that injection of investment or capital, but also indirect investment, equity investment through partners. And in the loan area, we have a range of them, termed or loan, royalty-based loan. Don't ask me to go into details of them because I can give a whole presentation on each. But also other types of them, convertible from loan that later on could be converted to equity. So we provide all of these, and our intention is that in the next 5 years, as part of our new strategy, to expand in those areas, because we fund innovations in all sectors: public sector, private sector, non-for-profit, public-private partnership, and so some of these tools are relevant to some of these stakeholders that we work with.
Luckily, there is an opportunity to do a deeper dive into some of these innovative mechanisms. Emily, over to you.
One of the things that a lot of us have noticed over the last few years is the decline of membership of donor organizations. And as one of the newer donor organizations, I'm wondering what made Grand Challenges join MMA, and what can we do differently to attract more donors like yourselves to re-diversify the membership of the Alliance?
Excellent question. Two main reasons for us, and I mentioned some of them earlier and yesterday. First was to learn from this community. And the reason we actually thought of joining was that as part of our learning and iteration of the Saving Brains portfolio, we have conducted a landscape analysis to define our future investments. And what came out was the polycrisis concept, that there are multiple types of crisis and fragility that affect communities, particularly children and their supporting ecosystem. So that, of course, was an indication for us to shift our focus on more fragile settings and investment in ECD in those contexts. And of course, MMA is the mobilizing factor or the network that brings us together. But the objective was first to learn. There is a vast set of capacity and experience and knowledge and wisdom in this network. And second, for us to also benefit and use this platform for exactly doing what we are doing right now, is just to disseminate our service, because we consider ourselves as a service provider to the sector, because we are not an implementer, but we consider ourselves in the service of the sectors in which we work, and our service is basically bringing more efficient and effective ways of doing business, sometimes totally new and transformative, in some cases incremental change that we offer. And how can we attract more funders like this? I think the conversation we had this morning is a great example of we need shake-up. We need like really hard shake-up so we wake up from the kind of the colonial system that traps us.
Thank you, Fawad. I'm going to offer you the last couple of minutes to share and promote awareness of the process and timeline.
Sure. So there, in the call for application that will be launched in January 21st is the date is confirmed. So we will have two types of grants. Proof of concept for up to $250,000 for any new idea in relation to ECD and education in emergency settings, of course, based on the priorities that we just discussed. They will be outlined clearly in the RFP. And so this could be just a brand new idea, even if there's no proof of concept, no evidence of effectiveness. This is the kind of fund that it's basically a seed fund. And it could be for 12 to 24 months period of testing. And so then we will enter into a partnership with innovators once they are selected to actually support them through that journey. We'll provide them support on anything they need. Institutional support, leadership, governance, technical capacity, evidence generation, impact measurement, all of that. And that is not included in that $250,000. So our transition to scale, which is basically our core business, we have one more minute. Transition to scale is for any ideas or innovations that have been tested before and has some proof of concept in place, some evidence to show it is effective, efficient, or both. And up to 12 to 24 months, up to $750,000. And that also comes with the support.
And just finally, because we know this morning we've got some fantastic innovators in the room with us, one of the things that came out this morning are the sort of thresholds in terms of organisational turnover, that you have to have a certain level of turnover to be eligible. Are those thresholds going to act as barriers, or is this genuinely open to new entrants?
It's generally open, and it's intentionally designed to allow like basic ideas who has no background, as long as they are housed within an institution, because the funding cannot be dispersed to a person. It has to be dispersed to an organization. They could be as small as like $10,000 annual budget or $10 million annual budget. But of course, the priority will be given to smaller, local, more marginalized groups.
That's fantastic. Thank you. I'm sure we'll hear more. We'll disseminate through Moving Minds Alliance when the call gets launched, and we look forward to hearing who the successful partners are. Maybe when we meet next year, we might hear, who's been awarded some of the funding.
That would be a great idea too.
And maybe we could even have some of those participants with us.